Hello guys, welcome to Launchpad Listen, Learn Medical Coding. So, if you want to learn medical coding terminology, how the medical term and medical words, anything, whatever you are seeing in your medical coding journey, so how that words formed. So you can take example over here. So here is a fundamental of how what are the basic component like that. One thing is root cause. So what do you understand by root word? So root word, that means base with core meaning. So here you will understand like heart. You well known about, but the root word for heart will be cardio, and for liver, the root word is hepato. So while I'm saying that heart, liver, but here cardi, C-A-R-D-I. But along with that, we will use combining vowel. So that is usually O or I. So for heart, it will be cardio. For gastro, histo. So for these root words, if you use prefix, so prefix, that means with the use of prefix, this will modify their meaning in context to location, time, and number. So soon you learn like that. Hyper, that means excessive. Brady, that means slow. Peri, around. So just think one medical term that prefix word is hyper and brady, like hypertension, bradycardia, like the same thing suffix word. So suffix words main function is this indicate condition, procedure, or disease, like that itis, inflammation, ectomy, that means surgical removal, or algia, that means pain. So you can use any medical term over here like that. Gastroenteritis, and if any organ is removed like that, appendectomy. So like the way, that means the term construction formula will be, you will use one prefix word, then root word plus combining vowel, then root word, then suffix. So let's take some example. So first example is gastroenteritis. So over there you'll get the first root word is gastro, that means stomach. Combining word is o, so that means here gastro. And the root word, the second root word is enter, that means intestine. So what do you understand by stomach and intestine? And the suffix word is itis, that means inflammation. So that means the meaning of gastroenteritis is inflammation of the stomach and intestine. So this is part of what? Abdominal system. Okay, like the same thing. Hepatomegaly. So here root word is hepat, combining word is o, suffix is megaly, that means enlargement. So you can say in normal understanding, if liver is enlarged, so the medical term will called as hepatomegaly. So these term will be documented in your medical record, and when the medical record will be formed. So it will written like enlargement of liver, like the same thing, pericarditis. So here a prefix is peri, root word is card, and combining vowel is I, and suffix is itis, that means inflammation. So that means inflammation of the tissue surrounding the heart. Like the same thing, here the first word is tachy, the root word is card, combining word is I, and suffix is a. So that means, what do you understand by tachycardia? When abnormal fast heart rate. Like the same thing, osteoarthritis. So osteo is root word, which is bone. Combining vowel is O, and R, ARTHR. That means joint. Itis means inflammation. So that means inflammation of the bone joint. Now the next example is bronchopneumonia. So broncho is what? Bronchial tube. Combining word is O. Root word is here pneumon, lung, and ia is condition, suffix. So that means inflammation of the bronchial tube and lung. Like the next example, nephropathy. So nephro means kidney, combining all is O, and paxi means surgical fixation. So that means nephropathy means surgical fixation of a floating kidney. Hypo, next example is hypoglycemia. So hypo means below normal, and root word is glyce, that means sugar. Emia means blood condition. So that means below normal blood sugar level. Now next example is dysphagia. So DYS, that means difficulty, painful. PHAG means eating, swallowing, and IA means condition. So that means difficulty swallowing. Then next example is rhinoplasty. So RHIN, that means nose. Combining vowel is O over here. And plasty, that means surgical repair. So that means rhinoplasty means surgical construction, reconstruction of the bone. So guys, so that means whatever medical condition is given in your medical record, or while doing CPC exam preparation or any medical coding exam preparation, you'll go through these medical terms. So if you understand the first and fundamental things, then only your approach, if you are applying this approach, okay, so you can solve any kind of question paper, or you can understand, okay, uh, uh, what happened in this medical particular condition. So like the way, if you'll understand root word and their meaning and their example terms and their definition, so most of the time you will get a medical condition. So that may be, here example, cardiomyopathy. If you'll get a chart, so there you will get a patient having disease of the heart muscle. So if you don't understand this thing, so how many time you will get this definition? But you understand cardiomyopathy and root word and their meaning, as I taught you earlier. So you can easily understand each and every medical terms under that meaning. Like that, osteoporosis. So that means here is what? Osteo, OSTE is what? Bone, and O is combining all. Porosis means what? With pores, and is is condition. So here these are the common root words. So these are the root words. Like the way, prefix, that means the word used before any word. So Over here you can see a term that is anemia. A-N. That means without or not. So that means here anemia means a person having without blood or lesser. Anti, that means against. So here anti term is before biotic. So that means biotic means what? Bacteria, and anti means against. So that means against life, right? Up term over here bradycardia. So see here cardia is what? Referred to heart condition, and before brad is given that means slow. So like the way you can learn many more word over here you can see. Now see the suffix means what? The word which is given after the root word, like that. Algia, algia, neuralgia, neuro, neura is Neur, neuron is main term, and the suffix word is algia, that means pain. So that means nerve pain. Here appendix is what? Which is related to root word, which is appendix, and the suffix that means last word is ectomy, that means removal. So that means removal of the appendix. Here is cardiology. Logy means study of. So that means study of the heart. So like the way you can learn many more these root word, suffix, prefix, and if you understand this, so your medical coding journey will be easy. Whether you are in any stage, and if you guys are working in any position, any designation in any project, so you will always get a medical record, and over there you always stuck with these medical terms. So that means here you understand how the word elements, about root words, about prefix, about suffix. So that means root word what? These form the base of the medical term and hold the fundamental meaning. Prefix, that means attached to the beginning of the word to modify meaning, and suffix, that means attached to the end of the word to indicate procedure or condition. And when we are using combining vowel, so that means, so this is the combining vowel which is connect, which is connecting multiple root words. Now you are going to construct a word. So that means following proper rule of building complete medical term. Now pronunciation means learning how to correct pronounce medical terminology, and after that you will apply this coding law knowledge to the medical coding. I hope you guys understand, and in the next class, we'll learn anatomical position. So you know that in human body there's many kind of anatomical position. Okay, you mostly heard about anterior, posterior, medial, lateral, superior, inferior, proximal, distal, superficial, deep. Okay, now what is body? Plane, sagittal, frontal, transverse, and different kind of body region and cavities also they were like that: cranial cavity, spinal cavity, thoracic cavity, abdominal cavity, pelvic cavity, and abdominal pelvic region having these quadrant system. And once you will understand this thing, um, the next thing is when a person is going for any kind of X-ray or imaging. So there are some terms mostly used. You heard about that transverse, right? Then sagittal, then tropical. So these are the terms mostly used in this imaging technique like CT, MRI, ultrasound, X-ray. So that means when you will understand the medical term, then you will understand better anatomy. So the ultimate objective of this medical term and anatomy, you will review combine form, prefix, suffix, understand diagnostic procedural terms, learn basic anatomic related to medical coding, and the medical terminology, basic like word element, what just now I told you, root word combining prefix, suffix. So like the way you will learn many more things. So here you can whatever taught you just now. So when you are going to going to make to understand any medical term, so either you will understand root word, prefix, suffix, then just apply this thing with combining vowel, with the root construction, with the pronunciation, and after that just if the specialization related to anatomical term, procedure, diagnostic. So like the way you can form or understand any medical terms. So see you guys in the next class. You will learn many more things. uh, just I'll show you one thing like that. If you want to learn integrated system, so so here's the overview. Primary function of integrated system, skin structure and component, and many more things like that. You will learn all kind of organ system. Thank you.